We're looking for technology, new technology, to understand an individual's long-term radon gas exposure. So right now in Canada, 2 out of 5 people who will get lung cancer cannot currently be screened for lung cancer. And if you can screen someone, you can detect their cancers early. We can't do that for 2 out of 5 people because their cancers are not attributable to tobacco. They're in fact amongst the 40% of people who get lung cancer from non-tobacco causes, including radon gas, air pollution, and other things. So for radon, we need a new way in order to understand someone's long-term exposure. And the clue for that, as it turns out to our surprise and everyone else's, turns out to be in our toenails.
Is that once we have the toenail samples and they're digested and we extract the lead from those samples, we use this instrument to quantify the number of atoms of lead. And from that information, we try to then correlate with that individual's exposure to radon gas in their home environment.
And so we did this on a cohort of just about 40 people over the past 5 years, some of whom had known really low radon exposure, others who had known really high radon exposure. And we asked the question, did the amount of radioactive lead in their toenails actually correspond to high versus low? And the answer is it did.
It's a truly groundbreaking approach because we're measuring an individual's exposure to radon, and we're using the evidence left behind by the radon decay. That's this 210 lead. And to use something like a toenail is kind of a neat idea because it's very non-intrusive. You know, cutting off a little bit of toenail and giving it for analysis is a very simple procedure.
There's so much stigma around lung cancer, and everyone believes that smoking is the cause of lung cancer, but in reality, many of us, and the numbers are rising of never smokers who are now being diagnosed with lung cancer, especially younger women. And so everyone needs to know that if you have lungs, you can get lung cancer, and that's why these studies are so critical.
We're recruiting Canadians to get a radon test, and at the same time collect all their toenail clippings and send both a radon test and the toenail clippings back to us here at the University of Calgary Charbonneau Cancer Institute for us to analyze those and determine if the pilot trials positive observations are correct for everybody in a much larger group. And if all of that works, we should have the ability to add in a person's long-term radon exposure to the criteria used right now to assess a person's risk to decide whether they need a lung cancer screen or not. And if we can do that, many more Canadians who need early diagnosis for lung cancer will be able to achieve that in our future.